Hi, and welcome to this Friday's 5-minute consult with your favorite family medicine doc. In these videos, I discuss everything that you need to know about some of the most common health conditions listed from A to Z, and today's topic starts with the letter M. So let's talk about migraines.
What are they?
A migraine is a stronger type of headache that can come with other symptoms including nausea, vomiting, sensitivity to light or sound. It classically presents on one side of your head and it can last anywhere from a few hours to even a few days. What are the symptoms? Migraine symptoms can be different in each person, and there are actually 4 stages of symptoms that I'm going to go over today. So the first stage of symptoms is known as the prodrome stage, and this stage can occur hours or even days before you get the actual migraine headache. 60% of people who suffer from migraines experience these symptoms, and they can include sensitivity to light, sound, or smells, mood changes, fatigue, food cravings or loss of appetite, severe thirst, as well as bloating, diarrhea, or constipation. The next stage of symptoms is known as the aura stage. These symptoms stem from your nervous system and can affect your vision. They usually come on gradually over a 5 to 20 minute period and last usually less than an hour. You may notice tunnel vision as well as seeing spots in your vision like black dots, wavy lines, or flashes of light. Some may experience symptoms where they cannot see at all. You can notice ringing in your ears or changes in your smell, taste, or touch. And sometimes the symptoms you experience with aura can even resemble symptoms of a stroke, which can include a heaviness in your arms or your legs, tingling or numbness on one side of your body, or the inability to speak clearly. The third stage of migraine symptoms includes the actual attack of the migraine. A migraine headache can start out as mild or dull in the beginning and gradually progress to more severe pain. The pain is usually considered a throbbing sensation and it gets worse with activity. It can move from one side of your head to the other or start to affect your entire head. About 80% of patients who suffer from migraine attacks do also have nausea associated with it, and about half of those people end up vomiting. You may also feel pale, clammy, or faint with a migraine headache. These headaches usually last up to 4 hours, but some can last up to 3 days. Most commonly, they occur 1 to 2 times per month, but some people can get them every other day, and some people may only get them once or twice a year. The last stage of symptoms is known as the post-drome stage, and with this stage you can have symptoms that include muscle pain or weakness, food cravings or loss of appetite, as well as feeling extremely tired, fatigued, or cranky. What is the cause? The exact cause of migraine is unknown, but nowadays doctors believe that when a migraine starts, it is due to your nerve cells overactively signaling to the trigeminal nerve. This can lead to the release of certain chemicals, including serotonin and something known as calcitonin gene-related peptide, or CGRP. CGRP causes the blood vessels in the lining of your brain to swell, and this signals neurotransmitters to lead to inflammation and pain. The American Migraine Foundation estimates that 38 million Americans will suffer from migraines, and some risk factors include gender, as women have migraines 3 times more often than men, age. Most people start having migraines between the ages of 10 and 40, but women who have migraines tend to notice their symptoms improve after the age of 50. Family history is another risk factor for migraines. If you have a parent who has a migraine, you may be 50% more likely to experience migraines yourself, and if both parents have migraines, then the child has a 75% chance of getting migraines as well. And lastly, other medical conditions can increase your risk for migraine, and these can include depression, anxiety, bipolar disorder, certain sleep disorders, epilepsy, or even some heart conditions. Now, when it comes to the cause of migraines on a day-to-day basis or throughout the month, you may have heard of something known as migraine triggers. There are many migraine triggers, and if you are one who suffers from migraines, over time you will want to learn what these triggers are for you so that you can avoid them for the future and prevent having a migraine headache. So one of the triggers includes hormone changes. Many women often notice they get a migraine around their period time. They can also have more migraines while they are pregnant or ovulating, and since women typically go through more hormonal changes, probably explains why women are more likely to get migraine headaches. Being on birth control or going through menopause and starting hormone replacement therapy can also be considered a migraine trigger. Another trigger for migraines is stress, and the reason is because when our bodies are stressed out, they release certain hormones, and these hormones can affect the blood vessels in our brains. Certain food or drinks can lead to migraines, and these typically include aged cheeses, also alcohol, and certain food additives like monosodium glutamate or MSG, which is in a lot of processed foods, or nitrates, which is in a lot of luncheon meats or pepperoni type meats, can also lead to migraine. For some people, getting too much caffeine or not enough caffeine can trigger a migraine. Also, skipping meals. Some medications, including vasodilators, can lead to migraine because they expand the blood vessels, and the vessels that are expanded in the brain lead to pain and migraine. Changes in your sleep or sleeping pattern can be a big trigger for migraine. If you are not getting enough sleep, or sometimes even if you get too much sleep, you can notice a migraine. If you are one who is very sensitive in your senses, you can get a migraine. Some people don't do very well with very strong smells, very bright lights, or very loud noises. Other migraine triggers include the use of tobacco. For some people, exercise or a lot of physical activity can lead to migraine. And lastly, some people also report changes in weather as a migraine trigger. Certain storms or strong winds can lead to changes in bariatric pressure, and also if you are at a higher altitude, you can experience a migraine. Diagnosis. Your doctor is going to ask you about your health history and your symptoms of pain. If you are experiencing classic symptoms of your migraine, such as pain on one side of your head or sensitivity to light or sounds, then you may be diagnosed with migraine headaches. Your doctor is also going to want to know how often you suffer from these symptoms, how long they last, if you have any family history of migraine, and any supplements or medicines that you are taking. If there are more concerns about your migraine headaches or your symptoms are worsening over time, your doctor can perform other tests, including a blood test, imaging studies such as a CT or MRI, or something known as an EEG, which is known as an electroencephalogram, which can detect further brainwave activities. What is the treatment? There are many medications that treat migraines, and the goal is to improve your pain. Most over-the-counter options work very well, and these include medications such as Tylenol or ibuprofen. You may also have heard of other medications over-the-counter that are specific to migraine, and one of those is known as Excedrin migraine. This medication includes aspirin, acetaminophen, which is Tylenol, and caffeine. Caffeine is added because it is known to enhance the pain-relieving functions of both aspirin and acetaminophen. Just as a word of caution, you don't want to be taking these over-the-counter pain medications for your migraine headaches on a daily basis. And the reason is because you can become dependent on them, and it can lead to something known as rebound headache. Therefore, as a general rule of thumb, if you are having to take an over-the-counter pain medication for headaches more than 2 days a week, then you will want to talk to your doctor about starting a prescription medication. The most common form of prescription migraine medications includes a class of medications known as the triptans. Some common ones you may have heard of include Imitrex, which is sumatriptan, or Maxalt, which is rizatriptan. Some of these triptan medications come in different forms, including a pill, a tablet you can dissolve, or a nasal spray that you can use. Another option to treat migraine headaches is to use other classes of medications that can help prevent migraine headaches. These can include certain seizure medications, blood pressure medications known as beta blockers or calcium channel blockers, some antidepressants, or even something known as botulinum toxin type A, otherwise known as Botox. If you find that both over-the-counter and prescription medications are not working to treat your migraines, there is also other devices that they have come up with that help treat migraine. And the first one is called single pulse transcranial magnetic stimulation. It's a device that you can put on the back of your head at the start of your migraine symptoms. It sends a pulse of magnetic energy to part of your brain that can help stop or reduce the pain. And the second type of device is known as a neuromodulation device. This one can affect either the vagus nerve or the trigeminal nerve to help reduce pain or symptoms of migraine. Now I just wanted to mention some home remedies that you can use to also help treat your migraine, and these can include some topical treatments that are more natural. They contain an ingredient called menthol, which is a very soothing topical ingredient that you can apply on your forehead or the area where you are experiencing pain, and this can help soothe or relieve the pain. Increasing your fluid intake while you have a migraine can also help because it helps prevent dehydration, and you want to be resting in a very quiet and dark room so that you don't have the overstimulation of the bright lights and bright sounds, which can worsen your migraine. For all of the patients that I saw in clinic who suffer from migraine, I also informed them that using a very warm washcloth over your head can really help soothe symptoms of migraine as well. And nowadays there are also a lot of complementary or alternative therapies that can be used to treat migraine, and these include something known as biofeedback. Biofeedback is basically being aware of your own migraine triggers and avoiding them to prevent a migraine attack in the future. Other alternative therapies may include massage therapy or acupuncture, as well as taking certain supplements, including the supplements of melatonin, coenzyme Q10, or the various B vitamins. Now let's talk about prevention. There are a lot of ways that you can help prevent migraines for the future, especially if you are one who knows you get migraine attacks and fairly frequently. These can include living an overall healthy lifestyle, which of course includes eating a proper diet, getting your proper amount of sleep, and exercise. You want to make sure you are eating meals on a regular basis so that you don't skip meals, which can lead to a migraine. You also want to be drinking plenty of fluids and manage your stress. For this, you can try things like relaxation techniques, including breathing exercises or meditation. You definitely want to be keeping a diary of when you get migraine headaches and see what types of triggers led to those so that you can avoid them. And lastly, if needed, you can talk to your doctor about starting one of those preventative medications, which could include a calcium channel blocker or a beta blocker. And that wraps up our discussion today on migraines. As one who suffers from migraines myself, I have a lot of empathy for anyone out there who also suffers from this type of headache. I hope that this information was helpful and informative for you all. If you have any other questions, please let me know in the comments section and I would be happy to answer those for you. If you would like to see more educational videos like these, be sure to subscribe as I am making new videos every Friday, and I will see you on the next video. Until next time, bye!